What happens in a case of a tight foreskin is he won't be able to pull back the foreskin at all, or there will be difficulty in pulling back and forth the foreskin over the penis, especially during erections. In this group of people, he won't be able to see the head of the penis also in complicated cases. Hello everyone, myself Dr. Abhilash, consultant laparoscopic surgeon from Apollo Spectra Hospital, Kondapur, Hyderabad. How many of you people know that tight foreskin can affect men's sexual health? So in this video, we'll be discussing what is tight foreskin, what is normal foreskin, and what are all the complications that are associated with the tight foreskin. To start with, what is foreskin? Foreskin is nothing but the skin that is covering over the penis. So what is normal foreskin means? Everyone will have the foreskin in excess, but the person should be able to pull back and forth the foreskin easily over the penis. This is referred to as normal foreskin, in which the patient will be able to see the head of the penis when the patient retracts back the foreskin. But what happens in a case of a tight foreskin is he won't be able to pull back the foreskin at all, or there will be difficulty in pulling back and forth the foreskin over the penis, especially during erections. In this group of people, he won't be able to see the head of the penis also in complicated cases. What happens or what complications can happen in a case of tight foreskin is, this tight foreskin can be because of two reasons. Be it phimosis. In phimosis, the patient will have a tight foreskin right from his childhood, so they won't be able to pull back the foreskin at all. Whereas in cases like balanitis or balanoposthitis, earlier he was able to freely pull back the foreskin, but later after they get contact with the sugar or once they develop diabetes, they will be developing cracks at the tip of the foreskin, or in few complicated cases, if the infection continues for longer durations, there will be white discharge also from the cut edges of the foreskin. If the person has got a tight foreskin, what are all the complications that can happen is, the first complication is hygiene, the second complication is interfering the sexual intercourse, the third complication is adhesions, and the fourth complication that can happen is something called as a cancer also. Apart from these complications, as said, in people with tight foreskin, because they have a compromised hygiene, these people, if they are unable to clear out all these accumulated secretions inside, there is an associated risk of developing carcinoma or cancer of the penis also in such group of people where the quality of the hygiene is severely compromised. To avoid all these complications from happening in every person with a tight foreskin, to have a better sexual life or to have a better hygiene and all, definitely circumcision will be needed in such group of people. Compared to the circumcision done in earlier days, people used to manually cut and place stitches. In recent era, there are advances to such extent that this circumcision can be done without any stitches by something called as a stapler. How exactly a stapler differs from a normal open surgery method is, just assume that if we have to stitch a cloth, we have to cut the cloth and we have to place the stitches. If the same cloth has been taken under a sewing machine, the thing will be done at a very fast rate and the precision will be much clear. The same thing applies for a stapler circumcision also. Instead of cutting the foreskin and placing the stitches, this will result in a prolonged surgical time and associated blood loss also. So to prevent all these things from happening, we have something called as a stapler circumcision, which offers a bloodless and a painless and a stitchless treatment. If you are having or suffering from a tight foreskin, then you can contact on the below mentioned details, where we will be offering you a stitchless, painless and a bloodless treatment. Thank you.